Lung cancer causes the most cancer deaths because it isn't usually diagnosed until symptoms like coughing up blood and unexplained weight loss appear. And unfortunately, this often means the cancer is already late stage. And even when lung cancer does cause symptoms like a persistent cough or wheezing, people mistake it for the effects of smoking, which can delay the diagnosis. This happens with other cancers too, like stomach and pancreatic cancers, because methods for early detection of these cancers hasn't come as far as those for breast and prostate cancer, for example. It has been shown that screening with low-dose computed tomography, or LDCT, is better than the standard chest x-ray at reducing the likelihood of dying from lung cancer. So the below guidelines for screening were established. It's important to understand that screening can lead to false positive results. In other words, it can create unnecessary alarm, which also then leads to more testing and more costs and other risks, including increased radiation exposure. Other drawbacks of screening include anxiety over abnormal test results, as well as the possibility that issues completely unrelated to the lungs may be uncovered, resulting in more tests, costs, risks, and alarm. And lung cancer screening won't detect all lung cancers. Some lesions are too small to be seen or get obstructed by chest tissue or because of human error. And the detection of a cancer by screening doesn't guarantee that death from lung cancer will be avoided entirely. Eligible patients should make the decision about screening together with their doctor. Some people value the opportunity to reduce the risk of dying from lung cancer and are willing to accept the risks and costs. Others will prefer to avoid testing that carries a high risk of false positive results and will just agree to accept a much higher risk of death from lung cancer. Adults who do choose to be screened should continue annual screening until they reach 74 years old and as long as they remain in good health. One legitimate concern with screening is that some smokers might use a clear scan as an excuse to continue smoking if nothing concerning is detected. However, evidence from other studies and from members of this program suggests that screening will have a positive effect on quitting. A scan costs about $300, and if you meet certain criteria, screenings are typically covered by Medicare and major insurance companies. However, it's always recommended that you talk with your doctor and check with your insurance company to make sure you qualify for the screening.